My colleague Asieh Namdar spoke to physician and medical journalist Dr. Alok Patel about racial injustice, both in society and in the healthcare system.
Dr. Patel, let me begin with the coronavirus pandemic. Our latest data shows Black Americans are dying from COVID-19 at almost 3 times the rate of white Americans. How much has this pandemic really exposed the staggering racial divide, the systematic discrimination that have existed for so long in this country?
This comes down to 2 separate issues. Black Americans are more likely to have certain chronic diseases such as diabetes, hypertension, and a risk of stroke. They're also less likely to have proper access to healthcare and be able to actually get to see a doctor. But then you have to look at their social determinants of health and the situations that they're in, which lead to these bad outcomes. So it does not have to do with their genetics. It doesn't have to do with who they are as human beings. It absolutely has to do with the conditions they're in and the systemic racism. And so all of us, from communities to public health experts to doctors, are sincerely hoping and begging that this pandemic is the last straw when it comes to systemic disparities in healthcare, and that we finally put an end to it.
And, you know, we've seen protests, massive protests across this country against oppression, against discrimination, against police brutality. And you, like many other healthcare workers, were out in the streets protesting. We've seen the images that you shared with us, your colleagues holding up signs saying racism is a pandemic too, white coats for Black lives. Silence is complicity. Talk to me about these protests that you attended.
Silence absolutely is complicity. And, you know, I'm very honored that there are so many healthcare professionals that are out there marching. I've been to 3 protests myself. And there are certain statistics that doctors, nurses, people have been shouting for years, such as the fact that you already mentioned that Black Americans are dying at more than double, almost triple the rate of white Americans with COVID-19. But we also have Black mothers who are 2 to 3 times more likely to die during the childbirth process than white mothers, or the fact that Black children are more than 2 times more likely to die in the first year of life than white children. The American Academy of Pediatrics released a big statement basically saying that racism is a huge determinant for children's health. These are the things that people are out there throwing out in the front lines. We're essentially protesting 2 things: police injustice, but also racism in healthcare. White Coats for Black Lives essentially has 3 goals. One of them is to actually address systemic racism. Get the dialogue going is another big goal. And then also we want to empower the next generation of advocates. And so it's important that so many people from different socioeconomic and professional backgrounds are out there with the same singular message. We're fighting 2 pandemics. We can do them both safely.
Such an important point you're making there. And some of these protests we've seen have gotten violent. Police have resorted to using tear gas and pepper spray. How concerned you are, first of all, that those protests with many people wearing masks, will that help contain or prevent the spread of the virus? And what about the chemicals, the tear gas and pepper spray? Could that potentially spread this virus?
So it goes without saying that I am concerned, that I don't share this concern alone. This is a lot of people out there are concerned that these protests could cause new outbreaks in coronavirus. You know, right now we're seeing an uptick in cases in over 20 states. We think that's because of what was happening 2 weeks ago, Memorial Day, and different reopenings, school openings, etc. But right now you have a lot of people who are out there, and many of them are wearing masks, are wearing eye protection and doing their best. But a lot of people
Dr. Patel, there's no social distancing.
There isn't social distancing. And that's one thing that we want to stress to people. It's really important to get out there and exercise your voice. But we also have to be realistic about the fact that we're still in a pandemic. So, you know, we tell people, if you have symptoms, if you're high risk, know your risk profile. It may not be safe for you to actually be protesting, but you can still be an advocate in another way. And I have colleagues, ophthalmology or eye doctor colleagues, who have explicitly talked about the potential of injury from rubber bullets or tear gas. And tear gas is another reason that people are touching their eyes, which we know is another way people can transmit the virus. We really want to make sure that people who are out there are aware that they should be getting tested. And if they can't get tested, they need to be honest with people around them and possibly quarantine. But also, this is a big challenge for contact tracers. If there's an outbreak, contact tracers are going to have to send out some type of widespread message so people who were at a particular protest know they may have been exposed. But I have to stress again, even though we're doing our best to contain the coronavirus outbreak, we have to all collectively fight systemic racism. We can't let our guard down in either fight.